Yeah, I don't think there was any great career plan. I didn't come from a medical family. A number of people sort of follow family members into a medical career. I come from a family of school teachers, so well-educated folk. But no, I think I enjoyed health and science as subjects at school, and maybe had a little bit of aptitude in that area, but probably fell into studying medicine. But it's a great career to have embarked upon. Pretty lengthy course of study. And as I reflect back, I think I've now got a daughter studying medicine in Perth, and I think of the hoops that they have to go through to get into the course, and not sure whether I'd be a candidate these days. You need much smarter all-rounders than me. I enjoyed working as a general practitioner. In fact, I did it full-time for over a decade. So in terms of management roles, I was a bit later to the career than many with a similar background. I think in retrospect, it's actually proved to be a very good move for me. I through the general practice career, got a very good overview of healthcare issues generally. It's often said the GPs are the jack of all trades and the master of none, and that's possibly not respectful enough of the important role that GPs play. But it does indicate that you get a good overview of all aspects of healthcare. And when you're taking on roles in hospitals maybe on the other side, on the management side, it's very helpful to have been, an admitting GP, someone talking to doctors, talking to hospitals, trying to move your patients through the system, and now to have some control, if you like, on the other side of those issues. The background as a GP has been very helpful. I think I've always had good mentors. So as a younger GP, it was some of the more experienced general practitioners in the practice, and I think it's really important when you start off in a role, you look at people who've got the experience, and you soak up whatever information they can give you. Sometimes good and bad. In terms of the people who inspire me now, if I reflect on the last 12 months, it's absolutely the people at the front line. We've had a very tricky period here in Victoria, a very challenging 12 months. And, I think of what our frontline nurses, doctors, allied health practitioners and others put themselves through last year at a really uncertain time. Many of them exposed themselves to risks that they wouldn't have anticipated, when they were embarking on their careers. Epworth played a significant role in the aged care response in Victoria, including, on days when aged care had very unwell COVID patients and had no workforce to look after them. So, if I look for inspiration, I don't think it's people in the roles that I'm occupying. It's really the people who are looking after our patients. Yeah, so Epworth's somewhat of an iconic brand in Victoria. We somewhat coincidentally celebrated our centenary year in 2020, which didn't quite go as well as we might have anticipated. I think along with Qantas, we had our centenary year during the pandemic. But it's that longevity. We've got a good brand. We've got very much a traditional way of operating our hospitals, and I suppose the challenges in our sector, for not only for Epworth but for others operating private hospitals, are how do we respond to changes in models of care. There's a rise in day surgery versus overnight stays in hospital. Patients' expectations are changing. Digitisation is impacting what we do, and hospitals wouldn't be any secret to know that we're a bit behind on the digitisation pathway. So one of the challenges for us is not just to have great facilities, and Epworth's expanded 30 or 40% in size in the last decade, having been around for 100 years, but how do we innovate? How do we look after patients, not just in our traditional, bricks and mortar facilities, but how do we link to care closer to home, care out of hospital, and how might an investment in digital technology enable that? So, there's some of the challenges that we as a large organisation in Victoria face. Yeah, we already provide hospital in the home services out of our Richmond facility, although not on a big scale, but that has been going for 20 years. How much more broadly we provide that, to some extent links to how it's funded as well. It's sometimes hard for traditional hospital operators to get the funding that's required to be able to be the sole provider of in-home care. I think we'll look at all opportunities, both broadening the role that we play, but also partnering with others. We're obviously interested in great outcomes for patients. We'll play the role that we need to play. We know our strength is in hospitals, in surgical, medical facilities, maternity, more recently for Epworth, rehab and mental health. So, as well as those traditional strongholds, we'll look at what else we can do in terms of out of hospital care. And it's really good to hear that government have recognised it and are looking forward to funding it in the next budget. Yeah, there's several aspects of it, and as I've mentioned, hospitals are a bit behind. I've made the comment here a few times that in 2007, when I left general practice, I left a paperless office, and 14 years later in hospitals, we're a long way off the pace. So I think there's a digital experience part that we need to improve, and that requires an investment so that our patients and our doctors are not forever filling in data. There's another side of digitisation where Epworth has been a leader, and that's in terms of clinical digitisation, technology, robotics, so investment in equipment, and that's changed the landscape of healthcare over the last couple of decades. And then there's artificial intelligence and all the things that much smarter people than me know a lot more about, but that's impacting clinical care as well, the access to new ways of doing things, to evidence that supports decision making. All of these are aspects that are part of a broad digital strategy. And I think I've changed my thinking over the years. I thought it was all about an electronic health record, and maybe that was the digital panacea, if you like, but there's so many other aspects to it. And Epworth's adopting a sort of a problem-solving approach to digitisation, where we're asking our doctors, our patients, what are the things that are impacting you, and how might we, develop solutions within a budget to assist. So, yeah, plenty to consider, Wayne, and we haven't even touched on things like wearables and how we might better coordinate the care of our patients, enhanced by technology that's available. And what we do need, though, picking up on that commentary, is we need systems, though, that link patients through primary care, specialist practice, public hospitals, private hospitals, and out into the community. And at the moment, we've all got our own, bespoke and other, technology solutions that don't necessarily talk to each other. And I know that's been government's priority through things like the My Health Record and increasing digitisation. But if systems around the world that work between primary care and hospitals and save money, they have invested in those platforms that make that data transfer that you're referring to a lot easier than it is today. Yeah, I think it's a really important area, and Epworth does pretty well. We have a workforce that's 80% female, so we need to ensure that the governance of the organisation to some extent, or to a large extent, reflects our workforce. We do practice what we preach. I did the statistics on our board, and in a board of 9, At Epworth, 6 are female, and the board president, the role that I report to, Mary Jane Crabtree, obviously, as well. So it's an area where we think it's important. It's an area not just at board and executive, and my team has a number of very capable females as well. You do need to look at the data. You do need to look at how you're going. And we, as an organisation, are much more intentional in looking at our data and acting accordingly. An example being medical leadership roles, and Epworth, I don't think, would be any exception. Historically dominated by males, and so a number of our recent appointments have really targeted the talented females, of which there are many in our organisation, and with great results. And I mean, the other thing to maybe just reflect upon thinking about diversity is it's not all about gender either. It's, all other aspects of diversity in our workforce, and we're very active in making sure that we have a culture that promotes a diverse and talented workforce where everyone feels very welcome at work and hopefully looks forward to coming to work as well. Yeah, I mean, it's always tricky because we're in an environment in healthcare and in private healthcare where there's significant competition for talent. So we like to get all-rounders. We like to get people who've got good background and good experience. We'll look at where they've worked in the past, what experience they've gained in those roles, and obviously their ticket of entry is their qualifications for the role as well. So but there's a lot of talented people out there at the moment, and sometimes it is hard to differentiate between people just looking at CVs. So, we actively use people such as yourself, Wayne, and recruiters for looking at markets of people to ensure that we're getting access to the best talent that's available out in the market. And we also use a variety of modalities in terms of recruiting people. So, interviews and other ways of checking their credentials and making sure that they're the right fit for the role. And we've been really pleased. We've had a bit of turnover in senior executive roles in my time at Epworth, and made some really key and talented appointments. One thing is to back yourself. I remember when I missed out on a role a while back, made a wise person said to me, if you're not missing out on enough roles, you're not putting yourself out there enough. So I think healthcare people tend to be pretty conservative. They've often been, clinicians have generally done reasonably well in their career and maybe not had to interview too often. So, I think one of the things is to back yourself. Don't be afraid to fail, and to seek out opportunities. The other thing is, your ticket of entry is to have the appropriate qualifications. To make sure you can't control the opposition in terms of applying for roles, but you can control what you do in terms of your experience and your qualifications. I mean, the other tip in terms of leadership is not to try and be someone you're not. So look at the people around you. I think learn from those you work with, but be true to yourself and make sure that guides your leadership style as well.